Okay, Laura. I'm Carla. I'm a physical therapist assistant, and the therapist would like me to do some exercise with your arm. Is that okay? Mm-hmm. And one of the first things I'm going to do is actually, I know you're very comfortable. Can I take this away? All right. We'll cover her back up. Now, I need to work with this part of your shoulder first, and I'm going to step around the back of the table. Is that okay? All right. So I like to maintain contact because patients who have a little bit less awareness of the environment don't need you to break contact and sneak up on them and all of a sudden, bang, you're here again. That's not cool. So if you'll keep contact, talk to her ears quietly from here. I'm going to uncover her just a little bit here. And actually, I'm going to uncover her arm, keep her breast covered. And then I've got the scapula here. With the hospital gown, you can fold it back and you're right to the skin. I can do the same scapular motions here, way easier. Got more access. And I can do my rotations. You can see the rotation going a lot easier from here. But we don't want to just do everybody in whichever position and flip-flop them around a lot. That might not be so comfortable, so we can make adaptations. Once I've got the 6 actions going, and I know that it's mobile, I'm cleared to go ahead and move on to the glenohumeral. So I don't have to spend a lot of time on it. It doesn't take a lot of time to do range of motion to anything. Now from here, I'm going to go up into the sagittal plane, her sagittal plane. So shoulder flexion and extension. And I could get, if I stabilize here, I can get some shoulder extension. But I would stabilize here, feel that, bring it back up, down, here. But I would prefer that this gets supported here. This would be nicer here, particularly if it's passive. Now if it's active assist or active, I can just say, okay, and I can just coach and have her bring that back. But keep it in close. Don't let her wag it out here. It's not abduction. We're still going for extension and then into shoulder flexion. From here, I can bring her into abduction. Little switch there. Got to get the twist. Back down. Supporting all the body parts, a little twist, about 3 reps. Help me out here. There you go. And you guide as they're doing it, active or active assist, but you keep them true to the plane. Okay? From here, we can do, I can support and do internal and external rotation, or medial and lateral rotation. You could do from here, but we're going to limit a little bit. But it's a little bit awkward doing it in sidelying. Supine would be a preferred position, but I don't want to flip-flop her around like a pancake. Okay, I can check that out. No stretching. So I've done sagittal, frontal, and the transverse plane. Cool. One more with horizontal abduction and abduction and adduction. Abduction and adduction. And I'm done with the shoulder. And down to the side. Then I can do flexion. And actually I need to do here. So you have to modify depending on the situation. Here. Good skin, friendly skin contact. What I want to avoid here, and you can do this different ways, avoid crossing and avoid reaching and twisting a lot on you. Do it in a way that's more comfortable for you. And here, certainly patient comfort is a priority, but supporting the body parts, good skin contact, and nothing's wagging and flagging around. Cool? So I got both of those. From here, hyperextension, radial ulnar. Move right into the thumb. I'm holding the hand and the wrist, working that first joint. There. Doesn't matter which one. On any of these, it doesn't matter which ones you do first. Just attend to the movements of that joint. There. and there. Couple of reps. Doesn't have to be a lot. Boom. Out. Got the pinky done. Got the ring finger done. Now the other ring finger. Yeah. And don't forget abs and abs. So that's all the same. The hand has not changed, but your orientation where it is in your, for you, has changed. Make sense? When you're done, are you in any discomfort? Cover them up. Be careful when you're grabbing the sheet that you're not grabbing other body parts, and again, you've got contact that is being misconstrued as something that it's not. And thank you very much. Questions? All right, sideline. You've got to shuffle the furniture around in your head a little bit for where those planes are, but her anatomic planes never changed. Go for it.